Welcome to our pathology class. So today in our pathology class, we are going to be talking about one of the most important topic known as gastritis. So gastritis is one of the most diseases which is experienced by a lot of people, which is commonly referred to as ulcers. So in this video, we are going to understand how gastritis starts and what are some of the causes of gastritis. So before I start, don't forget to subscribe, comment if the video was helpful. So what is gastritis? So whenever we hear the word gastritis, just know that gastritis has to deal with the stomach, and titis means inflammation. So when you say gastritis, this is the inflammation of the stomach lining. But whenever we are looking at gastritis, we have two types, or we have two terms which can be used. So the first term is the one I'm talking about, gastritis, which can be only used whenever neutrophils are present at the site of injury. So whenever we have neutrophils present at the site of injury, it is known as gastritis. So why are we saying that only when neutrophils are present? Because we know that neutrophils are the cells, or are the white blood cells, which are responsible for what? For inflammation. So for inflammation to take place, the neutrophils need to be present. Then the next thing is we have another term which is known as the gastropathy. So when we are talking about gastropathy, this is where now there is cell injury and regeneration, but neutrophils are absent. So whenever the neutrophils are absent, the condition is known as the gastropathy. But both are talking about the same thing, the injury to what? To the stomach lining. So now that you have understood what gastritis means and the other term which we can use to replace gastritis, we are going to look at some causes which can cause gastritis. So what are the causes which can cause gastritis? So some of the causes which can cause gastritis are drugs which are known as non-steroidal anti-inflammatory drugs, such as aspirin, brufen. Those drugs can cause gastritis or ulcers. We'll see when we reach at the pathogenesis how these non-inflammatory drugs can cause ulcers. Then the second thing is alcohol. So the first thing is non-steroidal anti-inflammatory drugs, e.g. aspirin, we have brufen. Then the second thing which can cause ulcers or gastritis is what is known as the alcohol. So whenever you are too much consumption of alcohol can also destroy the lining of the stomach. Then also when we talk about the reflux, so whenever bile goes into the stomach, it can also cause what? Gastritis. Yeah. Then also injury, trauma. You have been in an accident or you have bent your body. That can also cause what? Ulcers. So we have written three causes. We have reflux, which can also cause what? Gastritis. And we also have stress-induced injury. So whenever we talk about stress-induced injury, we are talking about those injuries that have trauma effect, meaning you have been in an accident that stresses, in short, that stresses the stomach lining. Yeah, so these are some of the causes which can cause gastritis. So now that you have known what gastritis is, what are the causes of gastritis, we are going to look at the pathogenesis of gastritis. So when we say the pathogenesis, we are saying that the beginning of gastritis. How does gastritis start? Yeah. So when we are talking about the pathogenesis, we are going to be mainly focusing on this diagram here. So this diagram here will explain a lot on the pathogenesis of gastritis. So you need to pay particular attention to this diagram. So how does this disease of gastritis begin? So before we understand how the disease of gastritis starts, we have to understand the protective mechanism which have been put to protect the stomach from digesting itself, because we know that the stomach circulates a lot of hydrochloric acid. So that acid is also very, very dangerous to the stomach lining itself. So that's why the stomach has several protective mechanism which helps it protect itself from the hydrochloric acid. So what are those protective mechanisms? So the first protective mechanism are the cells which are known as the surface foveolar cells. So we have the surface foveolar. So what are the surface foveolar cells? So these are basically the cells that lines the stomach. There are epithelial cells which lines the what? The stomach, and their function is to produce what? Mucus. So they produce a thin layer of mucus. So they produce what? A thin layer of mucus that resists what? The acid. The acid, and it has a neutral pH. Yeah, so this is the function of the surface foveolar cells, which are found in the lining of the stomach. So their function is to produce a thin layer of mucus that can resist the acid, and they also have a pH. So they also have a neutral pH. So you are wondering, why does they have a neutral pH? So they have a neutral pH because they also circulate what are known as bicarbonate ions. So we know that a bicarbonate and an acid, when they combine, they neutralize each other. So that's why surface foveolar cells also have what? A neutral pH. So apart from producing mucus, they also produce what? Bicarbonate ions. Then we say that the second mechanism is that also this mucus layer, so the mucus layer also protects the mucosa from the potential physical damage. Yeah. So also this mucus, they protect the mucosa from the what? Potential physical damage. So what are the mucosa? So the mucosa, these are the cells which basically produces the mucus. Yeah. So they have to be protected by the same mucus layer which is produced. So now we have understood the normal, how the stomach protects itself from being digested. So now, how does ulcers or how does gastritis comes about? So now here we can say the disease. So one, we say that the first cause of gastritis is what is known as the non-anti-inflammatory, the non-steroid anti-inflammatory drugs, which can be aspirin, brufen, or other drugs which are there. So I'll abbreviate the non-steroid anti-inflammatory drugs. They can also be known as NSAIDs. So these drugs, they cause gastritis because they inhibit an enzyme which is known as cyclooxygenase. So this NSAID, they inhibit an enzyme known as cyclooxygenase, which is also abbreviated as COX. So this enzyme is responsible for production of prostaglandin A2 and 12. So meaning if this enzyme is inhibited, therefore the production of prostaglandins won't be there. And we know that the functions of this prostaglandin is to stimulate the production of mucus and bicarbonate. So meaning if mucus and bicarbonates are not produced, meaning the surface foveolar cells won't be protected. Therefore, they will be digested or they will be destroyed by the acid, causing an ulcer. So that's the first cause. NSAID, they inhibit an enzyme known as cyclooxygenase, which is responsible for synthesizing prostaglandins E2 and 12, which are responsible for protecting the mucosa by stimulating the production of bicarbonates and the mucus. Yeah, so this is what you can say whenever you are explaining on non-steroidal drugs. So these drugs, they basically inhibit cyclooxygenase, also known as the COX enzyme, which is responsible for the synthesis or production of prostaglandins E2 and 12. So if these prostaglandin E2 and 12 are inhibited, they won't stimulate the mucosa cells to produce what? The mucus and the bicarbonate. Then the other cause which we talked about is patient with urease. So what is urease? So when you are talking about patient with a urease condition or patient with a bacteria which is known as Helicobacter pylori. So we know that Helicobacter pylori, this bacteria has a lot of virulence factors which can enable it to cause gastritis. So one factor is known as urease. So urease inhibits the gastric bicarbonate transporter. So this bacteria has an enzyme, has a chemical which is known as urease. So we are saying that with patients with patients who are, or we can say that uremic patients. So when we say that uremic patient, these are patients with a urine secreting Helicobacter pylori bacteria. So these patients, they can develop ulcers due to the inhibition of the gastric bicarbonate transporter. We know that the bicarbonate ions are responsible for making the pH in the stomach neutral, or the pH at the surface of the mucus cells neutral, because they neutralize the what? The acid. But if they are not transported to the surface of the cells, meaning they won't be able to protect the what? The mucosa. Therefore, the acid will destroy the what? The mucosa layer. So uremic patients, basically the urease inhibits the gastric transportation of bicarbonate by inhibiting the bicarbonate transporter. Yeah, so this is the second way in which ulcers can come. Then the third reason we are going to look at is what is known as aging. So we know that when you age, your body starts fading. So in the process of the body fading, we have what is known as reduced mucin and bicarbonate secretion. So the secretion of bicarbonates and mercy reduces as you are aging. So again, this can also contribute to the cause of ulcers. Yeah, so the third one we say this aging which is associated with reduced mucin and bicarbonate production. Yeah. Then we also have the final but not the least cause of gastritis, which is hypoxemia or decreased oxygen delivery. It also may include or increase the incidence of gastropathy. So here it will either increase the incidence of gastropathy. So when we look at the diagram now, here you can